Dr. Elizabeth Murray is in studio with us this morning to talk all about a very important new law that pertains to children who have conditions that need to be managed by medicine, and medicines that have to be administered daily, sometimes timed medicines. We're talking about kids with asthma, with allergies, with diabetes, right? And you're here to talk about a new state law that impacts them.
It's exciting stuff. So these are serious conditions, potentially, especially when it comes to a severe allergic reaction or anaphylaxis, where time could be of the essence. So the law says that with a parent and a pediatrician's permission, that a child can then give themselves their medications if they feel they need it. So if they're out doing something and they feel like they're starting to wheeze and they're known to be asthmatic, they can use their own inhaler. The kids who are diabetic, these kids learn an awful lot about their condition. You can imagine a 14-year-old may have been diagnosed when he was 5. By the time he's 14, he's an expert, or we want him to be an expert. So not only does this give kids the chance to have a little bit of control over their health care, but it also reminds us that we really want to make sure that children have a good understanding of these chronic illnesses so they're able to advocate for themselves and keep themselves safe.
Some really important points here. You said this is an agreement between the parent and the pediatrician. The school nurse does come into this in some way, right? Because the school has to know that the parent has given consent.
Yes.
So the child then can test for these conditions, like test for diabetes, can administer these things. Why is this such a good idea overall? And why has the Academy of Pediatrics really supported this?
Well, 2 reasons. One is that, again, potentially life-saving. So the old way was a child known to have perhaps a peanut allergy, developing a reaction. Somebody would have to go to the nurse's office, get the EpiPen, bring it back. And so you don't want to lose that time. Now you have a child who maybe is out on the playground, gets stung, or has a reaction to a food. They can give themselves their EpiPen right away. And so, again, time is of the essence. So from a safety standpoint, that's great. But also, especially in the setting of diabetes, there's a lot of subtleties to that care, and there's a lot of moment-by-moment management at times that needs to happen. Plus, the child is feeling their symptoms, and so they know what they're feeling, and they need to act upon it. We're letting them do that at home, so we should be able to continue it throughout the day. They really can be masters in their own health.
Well, I like that, because what you're doing is then you're also encouraging the parent to let go to a degree and say, I trust my child. And that can be hard for some parents.
Very hard, and not every child is ready. No one is saying all freshmen have to be able to do this. We're saying when you feel that your child is ready and your pediatrician feels your child is ready, go ahead and you can participate in this program. Nobody is going to be forcing this on anyone. We're not expecting second graders to be giving themselves an EpiPen.
And that's a good question. So what I didn't ask earlier was, what is the minimum age?
There isn't. It's school age. It's school-age children.
Oh, okay. So this is really strictly on whether or not the child is mature enough, really, and whether the parent feels their child can handle it.
That's right. Another form at the doctor's office, another form to fill out.
Oh, goodness, yeah. But again, when I think about this, and just from my experience growing up, you had to go to the nurse's office if you had, say, an antibiotic. You'd just gotten over an illness, you're still taking your 10-day course or whatever, or anything. You really had to go to the nurse's office. This doesn't minimize the importance of the role of nurses, though, does it?
Not at all, not at all. I mean, we still are advocating for everybody to have a backup supply of their medicine at the nurse's office in case, things go wrong or it gets lost or somehow the medication gets damaged. It's always, we tell that for people with allergies anyways, they should have an EpiPen everywhere they're going. One in mom's purse, one in the car, one in the backpack, because when you need it, you need it. So we want to have them be involved. Plus, what if something happens and the child becomes very ill, the nurse still needs to have their action plan, their care plan. They still need to know what's going on.
So this doesn't cut them out of the equation.
Absolutely not.
They're still involved, but the child really must then be sort of in charge of themselves.
And the teacher, too. The teacher in the classroom, or the teachers. And a lot of times we'll find that the students' friends actually have a lot of knowledge too. Yeah, with so many allergies that are so common, you're starting to see that people are just more aware. Everyone, from the teacher down to the friends. That's a really good point. Really good advice. Thank you so much, Doctor. We really appreciate it. Welcome to the school year.
Yeah, so much that's new. So much. All right, coming up next, golf with a twist. Hannah is playing foot golf this morning. She forgot her golf clubs, but no matter, she's fine. She's got her 2 feet. And they're not 2 left feet. She's pretty graceful out there. We'll take a look coming up next.